Hi class. So I'm going to make this video on introducing you to some of the phlebotomy equipment that we're going to use in order to do a Vacutainer draw or a venipuncture on the antecubital space, which is your arm. So first off, you're definitely going to need some gloves. I have some nitrile non-latex gloves right here. And when we put on our gloves, you want a nice snug fit. Okay, you don't want them too loose because big gloves are going to get in the way, like when you put on your tourniquet and things like that. Let me kind of put this down a little bit. Okay, so let me show you. Here's a large glove. So see how that's really big, and this is just going to get in the way. So no, you don't want that. Your gloves serve as like a second layer of skin, so you want nice gloves. So I wear a size small, so believe it or not, putting on gloves correctly is probably one of the hardest skills, believe it or not. But it always happens if somebody's watching you and you always mess up. So I'm just gonna pretend that nobody's watching me. Okay, alrighty, and then here we go. Okay, and I always kind of squeeze them together. So first off, we have our needle, okay, and this is a Vacutainer needle. I don't know if you can see it there. The opaque side, the colored side, always has the live needle on the end. The clear side is covering the bore needle, which we're going to talk about in a minute. This is a 22 gauge 1/4, okay, and if you never know, it's always labeled, okay. I don't know if you can see it there, camera work with me, but that's what it is. It's also the barrier, so you know it's still clean, it hasn't been opened because that seal hasn't been broken. If you're wondering what this little pink thing is, this is the safety, okay, and we're going to talk about more of the safety here in a little bit when I teach you how to put it together. Next you have the Vacutainer Hub, okay, and this is the casing that's going to go around the needle, and it's also going to house the tubes, okay. I also have some Vacutainer Tubes. This is a tiger top, also known as a marble or red and black. However, wherever you're from, different places call it different things. Back in my day, we always called it a tiger top, so we're going to call it a tiger top. The tiger top does have the gel separator on the bottom, and that's the only thing it has inside of it. It doesn't have any other additives inside of it other than the vacuum. So all of these vacuum tubes, different colors, mean different tests. They all have additives except the red has no additives and no separator. And the marble or tiger top has the gel separator, and we use these when we centrifuge. So these are great for like serum tests, chemistry panels, things like that, okay. You're also going to need cotton, alrighty, because we do have to, you know, dab our patients if they do start bleeding. When we prep our patients, you're either going to prep them with an alcohol pad, or you might use an alcohol pump and a cotton ball. So whatever you have on hand is what you're going to use. So these are just some of the items, okay. I'm going to make another video kind of showing them how we use it. And of course we have our awesome non-latex tourniquet, which is also one of the hardest skills to master, and you have to be able to master this in order to really draw blood well, okay. So I'm going to turn this camera around, bear with me, so I can show you how to put the stuff together, okay? Oh, don't get dizzy on me. Let's see what that looks like. Can you see me? All right, so here's the hub, okay, and then here's, let me move all that out of the way, here's the needle. So what I like to do is I like to hold it nice and tight in the center, just like this, okay, nice and tight. Even if this particular product did not have the safety on, I would still hold it nice and tight in the middle, okay. We're gonna leave the safety just down where it is, hold it nice and tight, and then in one swift motion, I'm going to take off the cap. When I take it off, you wanna tug on it and just keep on going, because if you do it short, what's gonna happen is the cap's gonna kind of ricochet back, and then you can like stab your little finger there, and I call that the little Sleeping Beauty, which is not good. It would be a clean stick, but still we don't want to do that. Okay, ready? So nice and tight, 1, 2, 3, and there we go. So this cap would go in the trash. Ready? Here's the bore needle. So underneath this plastic sheath, if you will, I don't know if you can see it, is the needle. I'll pull it back so you can kind of see it, just for, you know, demonstration purposes. Do you see that? I don't know if you can see it, but there's the needle, okay? Alrighty, so we're gonna pretend that I didn't do that. So this is gonna go inside this hole, inside the Vacutainer Hub, okay? And then you just put it in, and it's got a lure lock on it, which means you kind of screw it in. So righty-tighty, lefty-loosey. So here we go, righty-tighty, lefty-loosey. Don't force it because you want to break it. And you just snug it on until it's nice and snug and it feels good to you, okay? These little wings, if you will, are called the flanges. So when I put my Vacutainer together, I like to have the flanges, I don't know if you can see, in line with my needle, okay? And notice that you want the safety up, okay? The reason for that is most of the time your bevel is going to be up, and let's check that out now, see if that's the case. I'm gonna take the needle off. So same concept, hold on tight, 1, 2, 3. Okay, there goes the needle. I'm gonna kind of zoom in. I don't know if you can see it, but do you see the bevel there? Kind of has the hole in it. Don't worry, I have a sharps training. I'm not gonna stab myself. You can kind of see it better there. That little hole is the lumen, and that slant is the bevel. So when we go to take our blood from our patients, we always want the bevel side up, okay? So when you come out of the patient, what you would do one-handed with the safety is you just flip it up, and then you would dispose of it into the sharps container, of which I'm going to do right there, okay? So I'm gonna do it one more time. Get some more supplies here. This time I'm not gonna play with that sheath. Again, excuse me, I'm gonna hold on tight. 1, 2, 3, take that off, dispose. You're gonna bring that in, lure lock it in place. Okay, this is good, nice and snug. Oh, but the flanges are a little off, so I'm gonna kind of unscrew it a little bit till it's where I want it to be. And that's where I want it to be, right there. Okay, so I'm not going to show you how we put it inside the patient yet, but I do want to show you how and where the tubes are going to go. We're going to do a couple different tubes. The first one being a lavender tube. This is a kind of a smaller tube. It's not very thick on the top. So when you put it in, you're just going to slide it in. Okay, when you house the hub, you always want 3 fingers on the bottom and your thumb on top. So just like this. Okay, so this would be essentially inside the patient vein, and then with your opposite hand, your non-dominant hand, you're going to get the tube and you're going to place it in the hub with the label side down, and that's so you can see the flash of blood. So holding snugly onto the hub here with my thumb and fingers, you're going to grab those flanges. I'm going to do it the other way so you kind of see what I'm doing here, okay? And you're just going to push that tube in, and that vacuum is going to activate, okay, and it's going to pull out the blood. Then you're going to kind of put pressure on your patient's arm. You're going to kind of turn and pull out, okay? So it's like a turn and a pull. Notice my fingers kind of pushing against that flange to pull it out. So turn and pull out. Let's say I had to do another tube. This is the tiger top. This is a much thicker top, so you're going to feel a lot more resistance here. Remember, label side down, so I can see that. The reason we do that is because if the label's up and we don't see flash, we might want to turn to see, oh, did we get blood? And then we accidentally move or come out of the vein. So this time I'm going to do it how I usually do it, which is from the top. I'll just lift my fingers here so you can see. So 1, 2, 3, a little bit more resistance, but we got it. And then the turn and the pull, okay? So that's kind of how that works out. I'm going to show you the safety one more time. I would have pulled it back to go inside the patient, okay? So let's say I came out again with one hand, never bringing the other hand in to do that, because again, you don't want to accidentally stick yourself. So coming out of the patient, flip that safety, and I heard that click, and into the sharps. All right. So that's just a little bit for right now. Don't get dizzy. there I am. I'm going to post more pictures on actually putting on a tourniquet on our patients. I want to talk about the different types of skin our patients have, and we're actually going to draw blood. Okay, stay tuned.